Hey guys, Dan with Rise. Want to kind of talk about what's about to happen. As most of you know, I'm going to be having a surgery today, and we're going to be testing some theories. So the goals of today's surgery are to have a pain-free, uneventful surgery on my shoulder, have a pain-free recovery 3 times faster than a normal recovery would be, and be completely absent of any narcotics. You know, it's really important, I feel like, that I am doing this because, you know, in the opioid epidemic, we're addressing only small pieces of it, and I don't think that we're not addressing big pharma, we're not addressing the doctors, I think, to the level that we should. I was told when the first doctor that I consulted when I was gonna have this surgery, that if I didn't take an opiate or a pain med like that I would just have to deal with the pain. And I think that that's nonsense. If there's an opiate addict that's relying on naltrexone or a naltrexone implant to maintain sobriety, it's not very fair for them to have to be off of it so then they can be put on the drug of their choice, which is probably not going to help their pain anyway. And yeah, we'll see you all on the other side, and I hope you, if anything, enjoy the show.
Well, hello everyone. I'm Dr. Todd Akins. I'm the anesthesiologist who did Dan Hobson's case, but I'm also the medical director for surgical services here at Brushy Creek. Surgery went great. His heart rate stayed in the 70s throughout the entire case, with very few exceptions where some things were being done or medication given and manipulated where it bumped up momentarily. But 90% of the time during the surgery, no matter what stimulation was going, his heart rate was in the 70s. His blood pressure was within about 10% of his baseline. So surgery went great. He never had any spikes. He was not paralyzed either. He was breathing on his own, had an LMA, but was not paralyzed. So if there were periods of major stimulation and the ketamine were not doing anything to control his pain, he would have reacted. He had the ability to move. He could have moved his feet, he could have moved his arms or legs. His heart rate would have increased, his blood pressure would have shot up. None of that went on, so the ketamine seemed to do a really good job. I think as we see, it proves that you can be on naltrexone oral or a naltrexone implant and have all your opioid receptors blocked, and you're still able to get good pain relief for surgical purposes with ketamine, and definitely with regional anesthesia and local and blocks.